worked as an obstetrician now for 15 years. I joined the profession by choice, having been brought up by a family of doctors. I deal with two lives, that of the baby and that of the mother. It's a hugely rewarding profession, but it certainly does come with a huge amount of mental stress. My profession can be quite risky, especially when you're on your own on a night shift and, you're the individual responsible for that patient's care. I remember one time a couple came into the maternity assessment ward. It was very late, 2, 3 in the morning. I'd just come out of surgery, having carried out a complicated cesarean. The patient was experiencing severe pain down the one side of her lower abdomen and pain while urinating. I remember thinking, this could just be a stomach bug. But given her missed menstrual period, I couldn't rule out the probability of an ectopic pregnancy. And the patient was increasingly experiencing pain and discomfort. Given the history, I did a pregnancy test, and given the results of the test, I needed to undertake a transvaginal ultrasound scan. But hospital policy meant that we're not permitted to use this after hours. So I broke the rules. In obstetrics, you need to be able to make split-second decisions and have the expertise to act on it. Action needed to be taken right there, right then. Things can go wrong within a matter of minutes. The scan revealed that it was indeed an ectopic pregnancy, and we immediately sent her into surgery. Thankfully, we saved her life, and given the early diagnosis, we were able to save the fallopian tube. The next day, I received a request to see my line manager, and he told me that I was to be summoned to a disciplinary meeting because of my actions in using an ultrasound after hours. So I attended the meeting with my union rep, and they warned me that there would be further investigations. I was told that my actions could lead to dismissal. A further meeting was to be arranged. I was an emotional wreck. I immediately called medical protection for their assistance. I spoke to a medical advisor who supported me with the clinical side of my defense. I gave them as much information as I possibly could to support my case, recapping events that unfolded, supplying patient notes, etc. Medical protection prepared me for every eventuality that would occur during the meeting. Medical protection assisted me with the clinical side of the case. During the meeting, I explained the reasons for my actions, that I had made a difference to the patient's outcome, breaking the rules, but saving a life and improving the patient's fertility. They accepted my explanation. They considered me beyond criticism, and thankfully, I was exonerated. I remember the chair of the meeting coming up to me afterwards and saying, "I understand what you did." It was such a relief to hear that the board had seen sense in my actions and that common sense prevailed. I'm always on the edge of a potential bad decision. In my job, you need to make a decision quickly, sometimes in order to save someone's life. Most things you can deal with as a doctor. But it is a great comfort to know that we as doctors have someone like medical protection behind us in case something does go wrong.